Today, we are providing the information that an individual traveling from Liberia has been diagnosed with Ebola in the United States. This individual left Liberia on the 19th of September, arrived in the U.S. on the 20th of September, had no symptoms when departing Liberia or entering this country, but 4 or 5 days later, around the 24th of September, began to develop symptoms. On the 26th of September, initially sought care, and Sunday, the 28th of September, was admitted to a hospital in Texas and placed on isolation. We received in our laboratory today specimens from the individual, tested them, and they tested positive for Ebola. The bottom line here is that I have no doubt that we will control this importation or this case of Ebola so that it does not spread widely in this country. It is certainly possible that someone who had contact with this individual, a family member or other individual, could develop Ebola in the coming weeks. But there is no doubt in my mind that we will stop it here. It does reflect the ongoing spread of Ebola in Liberia and West Africa, where there are large numbers of cases. And while we do not currently know how this individual became infected, they undoubtedly had close contact with someone who was sick with Ebola or who had died from it. In terms of the flight, I understand that people are curious about that and wonder about it, but remember, Ebola doesn't spread before someone gets sick, and he didn't get sick till 4 days after he got off the airplane. So we do not believe there's any risk to anyone who was on the flight at that time.